Hi, this is Arthur Toller. I'm a doctor in chiropractic. I'm here to share with you the three most common mistakes that people make when they're in pain. The first one is that they will apply to the painful area heat, right? And we all know that people don't know, but most of the time, heat is for chronic. 90% of the time, chronic is for chronic injuries, not for acute injuries. So what we do is we apply hot water bottles, as commonly used here in the UK, instead of applying cold. Now, this is a mistake because 90% of musculoskeletal injuries, as we know, are especially in the spine and extremities, are of acute nature. You were gardening for some time, you bent over for too long of a time, your muscles were cold, and now your muscles went into spasm, and now you sprained that muscle or that ligament. So that means that when you go inside, you apply heat to that area, you will bring more blood to the area and make the area feel better, but only for a bit, and thus aggravating it further because you're exacerbating what we call the inflammatory process, and you don't want to do that. Now, nobody likes to apply cold when it's cold outside most of the time. We know that here in England it's all the time cold, but anyway, our bodies are warm nature, so we don't want to apply cold. But cold is always the best thing to apply. In a recent injury, in your spine or extremity, usually for 15 minutes. No more than that. 2 to 3 times a day. You could do it once a day. That's fine. Small towel in between to avoid the skin burn. And no more than 15 minutes, okay? So just remember, there's a mnemonic that I always use that I learned in school, and that mnemonic is called CBAN, okay? So that CBAN is C-B-A-N, and that stands for, those are the phases that your cold will go through whilst in your skin, because people ask me, how long should I leave it? Well, I tell them 10, 15 minutes, but you're going to feel cold. CBAN stands for cold, and then you're going to feel burning, then you're going to feel aching, and then you're going to feel numb. By the time it gets numb, you need to take the ice away, okay? So always think of that. If it's acute or recent, apply cold. If it's chronic in nature, such as arthritis in the hands, then you want to apply heat, okay? Now, the second mistake that most people make is actually they get told by another professional, health professional, GP, to rest. Just go home and rest and take some anti-inflammatories and painkillers. And this is a big mistake. If you rest and you just do nothing, this will contribute further to the atrophy of the muscles in that area, in that affected area. So all your joints and muscles, they all have receptors. We need to understand what are receptors. So receptors are, all joints have receptors that actually send messages constantly to the brain, telling the brain what to do, what's happening in that area, okay? So those receptors are actually sending messages to the brain constantly about what is happening with that joint, what is happening to that muscle. Now, there are receptors in our bodies called mechanoreceptors, which are in charge of actually, when we move a joint, those receptors are sending messages to the brain, telling it that we need to release certain chemicals that actually kill pain. So mechanoreceptors actually inhibit the formation of pain, and this is a if you don't move an area and the area just stays lying, you will have more and more pain. Less mechanoreceptors being fired, and that's worse. The more you actually move the area, the more the mechanoreceptors will fire, and the less pain you will have. And not only that, you will contribute for that area to continue healing and doing what it's supposed to do. Now, I'm not saying you should strain yourself and continue with the garden or whatever actually brought about the injury, but you should mobilize that area gently and go for a walk or whatever. And the best example about how these receptors work in your body is if you were to hammer yourself. If you were to use a hammer and you were to do a nail and you hit yourself with the hammer in the finger, what is the first thing that your body will do? Think about it. First thing, if you hammer that finger, is what would you do? Obviously, besides screaming and cursing, obviously, you will move that finger, and you will do that automatically. It's amazing how our bodies know instinctively what to do. Why? Because you're firing receptors, you're firing mechanoreceptors, and those mechanoreceptors will actually activate the formation of chemicals in the body that actually kill pain. So our bodies are constantly making painkillers, believe it or not. That's why people like to exercise, people like to run, people like to do different types of things, because it actually activates different types of receptors and different types of chemicals such as serotonin, dopamine, that are natural painkillers for our bodies. Now, the third worst mistake that people make is actually to take what? Painkillers and anti-inflammatories. Why? Nobody wants to have pain, and nobody wants to have an inflammation in the area. So we think that inflammations are bad, and that's not true. Anti-inflammatories are only taking your symptoms away, and painkillers are doing the same, but they're making you worse in the long run. Okay, so pain is just another symptom. You know, pain is not your enemy. Pain is actually your friend, because it's telling you that something is not right in the body. And the more painkillers and anti-inflammatories you take, the more likely you are to injure that area further, because you won't feel pain. So now you will be able to move that area past its physiological range that is supposed to be moved at that moment, because it's under injury. So your body actually gives you pain and gives you inflammation in order to avoid for you to constantly move that area. Don't move me, rest me, I need to heal, okay? And that's exactly why the reasons why anti-inflammatories are not the best thing for you to do. Remember, your body's constantly making anti-inflammatories, which are called prostaglandins, but we need to have the right chemistry in our bodies for our bodies to make those natural anti-inflammatories. And the inflammation, the best way to reduce inflammation naturally is with ice, not with heat. So in summary, best thing to do, apply cold to the area, move gently to avoid just laying in bed, no movement, and get your spine checked as soon as possible with your chiropractor. So in order for you to remove your subluxations and allow better communication in that area so your body could heal faster.